Welcome to Doctor's House Call. This is your chance to get in gear with Dr. Gear, a duly trained naturopathic medicine doctor and doctor of chiropractic, board certified in family medicine and minor surgery. Brought to you by Payson Health and Wellness Center at 801 East Highway 260 every Tuesday afternoon from 5 to 6, live on KMOG. You can call in now and speak to the doctor at 474-2427 with any questions, or after the show, call Dr. Gear during regular office hours, 474-7409.
Well, good evening. Welcome to Doctor's House Call. Mike Farrell here with you, and in the studio, we have Dr. Weyrich. Good evening, doctor.
Good evening.
You're a naturopathic physician, also a specialist in aging medicine. Is that what you call it? Or
anti-aging medicine.
Anti-aging medicine. Well, that's better yet. All right. And it happens to be Men's Health Month.
Yes.
So your topic tonight is men's health, right?
That's exactly right.
Okay. Well, there are a lot of things, I guess, that just bother men.
Yes, and actually I will touch also on breast cancer, because there is a correlation between things that cause breast cancer and treat breast cancer and things that cause prostate cancer, because biologically the tissues seem to be similar.
Oh, okay. Interesting.
Hello.
Yes, is this Dr. Gear?
This is Dr. Gear.
Oh, hello, doctor. How are you doing?
Thought I would call in and just give everybody listening a short update on what's been going on with me over the last 6 weeks. October the 13th, I had a cardiac event. My staff found me lying on the floor, unconscious. They applied what they had just recently learned, emergency cardiac respiratory revival, called CPR, and they were able to get me back to where the paramedics could take me to the ambulance of the helicopter, and then the helicopter took me to Honor Health at the center of Scottsdale. I spent 2 weeks unconscious, and the nurses assumed that I wasn't going to wake up at all and didn't bother to turn me, and so I developed a humongous bed sore problem that we're still working on correcting with 3 times a week wound care nursing, following up daily wound care nursing. And it is healing up, but it's been rather painful, very difficult. So aside from that, and not knowing who I was, the 3rd week, my memory kind of came back in bits and pieces. The 4th week, it was back pretty good. Now I think we're in the 5th week, maybe. And my physical body is coming back fairly good. The heart initially had 30% output. It now has better than that. I'm not sure what the percent is now, but it's better than 30%. And I'm able to walk with a walker 100 feet, then I sit down. So the body has a lot of recuperating to do, a lot of rebuilding to do. I'm taking medication twice a day, and I'm taking my nutritional supplementation 2 to 3 times a day, making certain that I can have the nutrition necessary for the body to rebuild itself. I understand Dr. Weyrich has been doing a great job educating everybody as to therapeutic nutrition and what's needed to rebuild different parts of the body. He tells me today he's doing men's health. That's a very necessary, important part for both men and women. You women out there need to make certain that your man has the right functions, and he gets that with the right nutrition and the right nerve supply. So, Dr. Weyrich, I won't horn in on your program anymore today. I might in the future, but not today.
Thank you for calling in.
And it is wonderful to hear your voice again.
Well, it's so nice to be able to have you hear my voice.
Yeah.
Not having a voice for the rest of eternity.
Wow.
Dr. Weyrich, you go on with your program. Thank you very much.
Thank you.
It's good hearing your voice, Dr. Gear.
Take care.
Okay, so that was a great interlude there. It's really good to hear what's going on with Dr. Gear. Let's start with the first topic, which is BPH, Benign Prostatic Hypertrophy, or hyperplasia, which basically means that the prostate gland, which is located between the urinary bladder and the penis, and urine has to pass through in order to urinate, it can get swollen and cause difficulty in urination, and it can get irritated and cause pain as well. And so men have concerns when they have BPH. Keeps them up at night. They have to keep getting up to urinate. And so what causes BPH? And another question that we'll address in a little bit, what's the relationship between getting BPH and getting prostate cancer? If you have BPH, does that mean that you're on the fast track for prostate cancer, or is it different? So let's talk a little bit more about BPH. So there are two different kinds of cells in the prostate, because the prostate is an organ, and it, like all organs, it is made up of a number of different cells that work together to accomplish the function of the prostate. And there are two kinds of cells that have been identified that are important here. One are called stromal cells, and the other are called epithelial cells. Now, that doesn't mean much to people in general, the layperson, but there are two kinds, and they have different names. So here's the important thing to know. The stromal cells tend to proliferate, to become more, increase in mass when you have BPH. But when you have prostate cancer, you have proliferation, growth of the epithelial cells. So there are two different cell lines, which means that they respond to some extent to different stimuli and different treatments. So what that suggests is, at a first level, if you have BPH, no, you're not at higher risk of having prostate cancer, or vice versa. So what can we do about BPH? Well, there's a lot that can be done, but it comes down to the prostate tends to be irritated by certain hormones, most specifically estrogen, and also it can be irritated by physical activity like riding a bicycle. So treatments for BPH tend to be naturopathic. Herbs are often used, although there are pharmaceutical drugs that are also used. But the most commonly used herb is called saw palmetto. And saw palmetto is a natural anti-estrogen type of natural product, and it reduces the sensitivity of the prostate cells to estrogen, which, as I said, the estrogen irritates the prostate and causes the cells to proliferate. So what's this about men and estrogen? Do men have estrogen? I thought that was, or many people think that's a woman's thing. And the actual answer is, if you look at how steroid hormones are made in the body, and by steroid hormones I mean anything that starts with cholesterol anything that starts with cholesterol, and through a series of chemical reactions in the body is converted into something with a name like cortisol or cortisone or aldosterone or estrogen, progesterone, testosterone. Those are all steroid hormones that are made from cholesterol. But the important thing to know is that testosterone is converted in the body into estrogen. And both men and women have testosterone and have estrogen as well. And the difference between men and women, one of the differences is the conversion process from testosterone to estrogen tends to be more efficient in women, which means, relatively speaking, women have less testosterone and more estrogen. But sometimes that enzyme is overactive in men. And when it's overactive in men, the men tend to have relatively less testosterone and relatively more estrogen. So what do we do about that? Well, there are both pharmaceuticals and natural products that can reduce the conversion of testosterone into estrogen. And those would be used mostly for men to reduce the level of estrogen that is irritating the prostate. Also, the pharmaceutical versions are used to treat certain cancers in women that are fueled by excess estrogen in the woman. And so there are drugs which will turn off the conversion of testosterone to estrogen in women, and that's often done to treat breast cancer, for example.
You know, I wonder, just this morning I got a thing in the mail about a pill that you can take that absolutely, is proven to help men that are having prostate problems. But the only proof they have are testimonials from several people who I've never heard of.
Okay, so
is that a racket?
Maybe, maybe not. There is good documentation in the literature that products like saw palmetto are beneficial. They're not miracle cures, but they are beneficial. And so there are a number of men's health products that do deliver some benefit. They're not silver bullets that cure everything.
No, and I don't understand. Why does it work for some people and not for others?
Well, two possible reasons. The first is that the diagnosis is not correct. And the second possibility is there's genetic variation in different people's response to pharmaceuticals and natural products alike. And so I talked last week about the importance of getting a good diagnosis, not drawing a quick conclusion that if this happens and then something else happens, this must have caused that. So if you have the wrong idea about what is causing the problem and you therefore use the wrong treatment, you're not going to get good results. So good diagnosis is important.
Okay, so it looks like if you go to, a specialist in this type of thing, they do one of two things. They either want to do surgery or they want to put you on a prescription drug.
Right.
And there even is one now, finasteride, I believe it's called.
That's one of them, yes.
And that particular drug is supposed to actually shrink the prostate.
Well, we're not so much concerned that the prostate gets shrunk.
Oh, really?
But the testes shrinking, which I think finasteride also does, is more of a big deal because the testes are responsible for making most of the testosterone in a man. And if you do things that shrink the testes, then, well, that's probably not going to achieve the goals of the patient, to be polite about it. So there's that. It's always important to get a good diagnosis. Let's move on to talk about another related issue that's very important to men, and that is erectile dysfunction. And A lot of people just assume that if a person has erectile dysfunction, that they are low in testosterone. And that's not necessarily the case. There are a number of different imbalances in the body that can cause erectile dysfunction. And so let me just go through a few of these. First possible cause is excess cortisol, which is another hormone. And cortisol is a stress-related hormone. So if a person is under a lot of stress, then that can shut down other hormone-sensitive parts of the body like the testes. And that can be a problem.
That also causes high blood pressure, doesn't it?
Yes. High blood pressure, inability to sleep at night, possibly. And if you have stress for too long, you get what's called adrenal fatigue and eventually adrenal collapse, which can be life-threatening.
So the cortisol is regulated by the adrenal glands? Is that what you're saying?
Okay, so in general, for most hormones in the body, there are exceptions, but the major hormones tend to be regulated by two different organs in the brain called the hypothalamus and the pituitary, which make hormones that talk to other parts of the body. But the hypothalamus and pituitary are also listening to what all the hormone levels are in the body and exerting what's called feedback control or balance. But when there's chronic stress, the body tends to shift into a mode of dealing with the stress and turn off other non-essential services. So again, with cortisol, running high levels of cortisol is part of the female athletic triad that leads to a lack of female development and infertility, lack of menstruation. So many female athletes that are overtraining and pushing their bodies to the limit, their menstruation stops. And same thing happens in men. They lose their mojo. So cortisol is a serious thing to deal with if it's a problem.
How do you deal with it?
Well, there are lots of ways to deal with stress reduction. Some of them are more mind-body control kinds of things. Some people self-medicate with various substances that can have other problems. But a lot of times it's just achieving positive self-talk. As Dr. Geer likes to say, don't overthink things and perseverate on things. If you can't control it, let it go. Worry about only the things that you have some control over and accept the rest. So another important cause of sexual dysfunction, both men and women, is hypothyroidism. Thyroid gland helps regulate energy metabolism in the body. Low energy, low function across the board. The immune system doesn't function well. The reproductive organs don't function well. And usually when there's a problem with low thyroid, it's best treated sometimes by finding a cause that can be treated. But in most cases, if you have a low thyroid, the best answer is thyroid replacement therapy. And very often, fixing the thyroid function, bringing that back to normal, thyroid levels back to normal, improves both male and female reproductive performance. And so that's something that I specialize in, dealing with the thyroid.
And how do you do that?
Well, there's a panel of tests that I like to do. Most doctors, conventional doctors that follow the insurance guidelines, will do one test called TSH, which is looking at a hormone made by the pituitary gland that is supposed to stimulate the thyroid gland to make the active hormone. But So if the TSH is higher than normal, then the doctor says, oh, the pituitary wants the thyroid gland to work harder, but it's not doing its job. So we'll give substitute thyroid hormone, because pituitary is saying we need more hormone, and the thyroid gland is, not doing its job. So that's the theory that is followed by most of conventional medicine that's paid for by insurance companies. If the TSH is okay, then the conventional doctor tends to say, well, nothing wrong with your thyroid, must be something else. And again, a good diagnosis of the actual problem is essential before developing an effective treatment for it. So if there's no obvious problem with the thyroid, the patient's not anemic, it must be in their head, is sort of the conventional thought pattern.
Well, wouldn't they also test for testosterone at that point?
Not normally, unless you have other symptoms.
But that could be tested.
Yes,
Right.
Yes. There are multiple ways to test for testosterone and estrogen and other hormone levels. There are the blood tests that are most standard. There are urine tests that give more information in some ways, less information in others. And there are saliva tests. And I can order any combination of those tests to tease out what it is I'm looking for.
Okay, if a man goes out and buys some pills to increase his testosterone, I understand there's some danger there.
Well,
doesn't it cause cancer if you get too much?
That's a good question that I'm going to address, but more to the point, most of the herbal products that are touted don't work very well. I do have a research list of actual evidence-based science that says that there are some herbs that are of some benefit in raising testosterone levels, but they work best for people with really low testosterone. And so they'll raise low testosterone a little bit, but they don't tend to lift it up into the bodybuilding range. And a lot of men are really looking for more than just a modest boost. They want to be power builders and so forth. Mm-hmm. And those pills aren't going to be very effective. And the other problem is that a lot of these pills, the quality control is not all that good, and there may be ingredients that aren't on the label. So there's a problem with herbal supplements being spiked with other things. It's the same problem that we have with pharmaceuticals being spiked with fentanyl, for example. So we were talking about hypothyroidism and said that in many cases the thyroid just can't make the active form of the thyroid hormone. And sometimes we have to supplement with thyroid hormone. Sometimes there are other nutritional deficiencies such as iodine, iron, zinc, tyrosine. But taking too much of these can cause problems, so you really need to do some testing to figure out what's going on if indeed it appears that there's a problem with the hypothyroidism. Another possible problem is excess alcohol intake. Alcohol suppresses the hypothalamus and the pituitary so that they make less of the hormones that cause testosterone to be made. So that's something to think about. I think Shakespeare commented a long time ago that wine increased the desire and decreased the ability. So there's that to think about. Another big problem is excess visceral fat. In other words, a spare tire around your middle. That can cause problems for a couple of different reasons. One is that the fat contains the hormone or the enzyme that converts testosterone to estrogen. So if you have a lot of fat, you're reducing your testosterone and increasing the estrogen. That could be the problem. Other problems, overtraining. We talked about that with the stress response. One way if you're overtraining, that is working out 5 hours a day or something, your body is going to shut down non-essential functions because it's overstressed. So enough said there. Atherosclerosis. That's the same thing. The hardening of the arteries that affect the heart also affects the male plumbing. And it's essential to have adequate blood supply to the genital region for normal genital function. And so if a lot of times the first sign that a man is heading for a heart attack is their erectile dysfunction crops up, and no, they don't need testosterone. They need to pay attention to their blood lipids and make sure that they don't have inflammation that promotes atherosclerosis. So it's something like a canary in the mine shaft. Another possible problem is close to Dr. Gear's heart, and that is the autonomic nervous system. That is the nerves that come out of the spine, the sympathetic nerves, and the nerves that come out of the bottom of the spine near the tailbone, and that come out of the skull, called the vagus nerve. Those are all part of the autonomic nervous system. And it turns out that you have to have the proper balance and activity of both the sympathetic and the parasympathetic to have the full male experience. If both don't work in harmony, things just don't work. And so spinal manipulation will help some men get their mojo back. Another possibility is sleep disorders. Sleep disorders, like sleep apnea, for example, can cause significant problems. And there's a study that says that 1 week of sleep loss can reduce testosterone production by 15%. So if you're chronically sleep deprived, your testosterone may be significantly lower. And inflammation is, as I said, it works hand in hand with high cholesterol to promote atherosclerosis. And the inflammatory neurotransmitters like interleukin-6, which is an inflammatory marker, do correlate with reduced testosterone. Then there's all kinds of drugs that can cause problems, and I'll just throw out a few of the more common drugs. Statin drugs, corticosteroids, opiates and opioids, anti-anxiety medications, antidepressant medications, blood pressure medicines, antihistamines like cimetidine, some estrogens and progestins, which are fake progesterone-like molecules, sulfonylureas, and things like finasteride, Proscar, and so forth, that are sometimes taken to treat male pattern baldness. Those can reduce testosterone. And some antifungal drugs. So that's just general categories. If you're taking any of these and you are concerned about erectile dysfunction, talk to your doctor about your concerns. Don't just discontinue these drugs to see what happens, because in many cases these drugs have rebound effects, and if you suddenly stop taking them, you can have even worse problems. Then there is environmental endocrine disruptors. So these are things that are in the environment that mess up our hormones. That's what an endocrine disruptor means. So a lot of plastics have endocrine disruptors in them. BPA, for example, is found in many plastics, and it's used as a lining to a lot of tin cans, what we call tin cans. They're not really tin anymore. But the canned food often has a plastic liner to it. So in general, you should avoid cooking anything in plastic. So don't cook in a soup can, like the hobos are pictured as doing. Don't leave your plastic bottled water out in the sun for extended periods of time. And try to avoid microwaving things in plastic containers or with a plastic wrap over the top. I always use a glass bowl and with a porcelain or glass plate on top of it, rather than using any plastic involved when I warm up food in the microwave. And foods can be endocrine disruptors. Soy can act as an endocrine disruptor. Sometimes it has beneficial effects, but sometimes it can have harmful effects. So especially for men, soy products don't seem to be such a good idea. And lots of other environmental toxins that are possible. Light pollution. This is something that is becoming more and more, we're becoming more and more aware of, and I've talked about it in the past on the show. Humans grew up in an environment where the sun went down and people went to sleep. And then we invented the electric light bulb, and people could stay up all night. And computers and cell phones and so forth have increased the tendency for people to stay up long past the time that the sun has gone down. And this messes with the natural hormone cycles in the body. Testosterone is one of the hormones that's released after a number of hours of sleep. Light pollution and messing up with the circadian rhythm of the body can affect endocrine function, both for men and women. And then there's a concept of earthing, which comes from, it's a very ancient technique in Ayurvedic medicine, where people would weave copper into their mattress and run the copper wire outside into a post, a stake in the ground, so that while they were sleeping, they were literally connected to the earth. And this improves the flow of negative energy, electrons, through the body, which is very healing.
You probably felt well grounded.
Yes, that's probably where the term came from.
Yeah.
And today, we don't use copper in this country so much. We use silver thread. Copper has a tendency to turn green with perspiration, and that's when that rubs off on you.
Yeah, I remember, copper bracelets used to be all the fad. They were good for your health and all that. But I had one, and it turned my arm green where I wore it.
Yes. But earthing is something to consider. It's been demonstrated to improve fertility, both of men and women. And if you want more information on that, I have a frequently asked question on my website, drweyrich.com. Just go to the FAQ section and scroll down for earthing. And I'll have something to say about that.
All right. And did you say you have the copper weaved through your mattress?
That was the ancient Ayurvedic technique.
Okay.
Today, we use silver thread, and you can get pillowcases that have the silver in it. You can get partial sheets. You can get whole sheets, fitted sheets. You can get all of that. And some places even sell shoes that have a conductive component to them that connects your feet to the earth while you're walking, and while protecting your feet from whatever it is that you don't want to step on.
Wow, that sounds kind of crazy to me.
Yes, there's a book called Earthing, and one of the stories they tell, true story, is that one year the Tour de France, the American Tour de France team, took with them a doctor to support their health who was into earthing, and they performed very well that year, and they had much quicker recovery times from various injuries that they incurred during the Tour de France by sleeping wrapped up in these earthing sheets. So there's a lot of, some might say it's anecdotal evidence, but anecdotal evidence, when it comes from many sources, start to become convincing.
Mm-hmm.
And as I say, it's a long-held tradition, so usually when a tradition sticks around for several thousand years, there's something to it.
Could be.
But as they say, your mileage may vary and batteries not included.
Right.
Another possible problem is syndrome X, insulin resistance, that we've talked about. In fact, some naturopaths say that they won't even treat a man with erectile dysfunction by prescribing testosterone until after they have gotten their blood sugar under control and resolved the insulin resistance, because they observe that men just don't get better if you just throw testosterone at a problem that's being caused by insulin resistance and syndrome X. You've got to fix the syndrome X first. Which leads me to another topic related to testosterone. When do men need testosterone? Well, tired and testy tends to be the early diagnostics. So if you're man and you become more tired and you become grumpy, and you're losing body mass, muscle mass, getting weaker, those are all signs that you might be deficient in testosterone. But again, good diagnosis is important. Why are you deficient in testosterone? And so this is a very important question to answer. Is it because your pituitary is failing to make LH, which is a hormone that stimulates the testes to make testosterone? Or do you have testicular failure where it's getting the signal from LH to make testosterone, but the testicles are where the problem is? So if you have testicular failure and addressing possible autonomic nervous system problems and addressing possible syndrome X type metabolic syndrome problems doesn't cure the problem, then yes, testosterone is the way to go. If you're demonstrated that you actually have low testosterone. But again, treating thyroid hormone imbalances first is also important, because if the thyroid's not working, then nothing's going to work very well. And there's another issue. If you are a man of reproductive age that wants to expand your family, you do not want to take testosterone, because testosterone in higher levels signals to the pituitary and hypothalamus that you have plenty of testosterone, they don't need to make LH anymore, or FSH, which is what stimulates sperm production. And so if your pituitary stops making LH and FSH, the man's own reproductive system will shrivel up because it feels like it's not being needed anymore. It's not being stimulated by LH and FSH. And so if you want to maintain reproductive ability, you don't want to take testosterone. Now, there are other approaches, but we have to look to see what the LH levels are to figure out, in addition to the testosterone levels, to figure out what the correct diagnosis is. Let's talk about the final topic, which is cancer, prostate cancer. So in the past, it has been the medical thought that testosterone provokes prostate cancer, and that has been proven not to be true. The original study that showed that testosterone provokes prostate cancer was done by a doctor who studied a total of 3 men. And these 3 men had already been treated for prostate cancer by castration. And castration, of course, lowers testosterone levels to just about 0. And so under these circumstances where men who had prostate cancer already, advanced levels, and then were castrated as a treatment, and then given testosterone, testosterone seemed to make their problem worse. And the original doctor said it was like throwing gas on a fire. And so conventional wisdom from that study of a total of 3 patients led to the widespread use of castration and chemical castration, that is, drugs that have the same effect of destroying the testicular function. And of course, these men are miserable with no testosterone to speak of in their bodies. But more recently, a doctor by the name of Morgenthaler did additional studies and found out that men with lower testosterone today are more likely to be diagnosed with prostate cancer in the future. So that was kind of curious. If low testosterone status causes more prostate cancer later on, what's going on? And so he did repeated studies, and it's generally accepted now that testosterone does not cause prostate cancer and possibly doesn't even aggravate prostate cancer in men who have not been castrated. And so it's a whole new paradigm. But unfortunately, there are still doctors that haven't gotten the new message, and they're still recommending the chemical castration and so forth. But again, what does seem to cause prostate cancer is elevated estrogen levels. Now, one way to get elevated estrogen levels is to take extra testosterone, inject testosterone into the body to elevate the levels to abnormally high, above physiologic levels. And the body reacts to that excess testosterone by converting it into estrogen. And you wind up with too much estrogen. So any patient that I have that is being treated with testosterone, I always follow their estrogen level to make sure that that's not creeping up. And if it is, that's a red flag that we need to modify the protocol. And
how do you monitor that, doctor?
It's a simple blood test.
Okay.
Or urine test, or saliva test. As I said, there's a lot of ways to test for the hormone.
So like a saliva test, you could do that right in your office, or?
I collect the saliva and send it off to the lab.
Oh, it still has to be sent away.
Yeah,
okay.
I don't have an in-office
Well,
test.
of course, that's true.
And for the saliva or the urine tests, I usually send the patient home with a collection kit that they mail off after they've collected the material.
Okay.
But I can also write a prescription to take to Sonora Quest to get the information as well.
All right, that answers my question. I just was curious about that. You have a way also of measuring the pain, don't you?
We have a way of evaluating how the muscle function is working. So far as measuring pain, we have to use a visual analog scale, which is basically a 0 to 10. Tell me, is the pain so bad that you can't think straight, or is the pain so bad that you have to stop what you're doing, or how bad is the pain? So we can evaluate that subjectively based on a pain scale from 0 to 10, 10 being the worst imaginable pain. Usually patients don't walk into the office with 10 out of 10 pain. They might say, I had that yesterday when I picked something up, it was 10 out of 10 and it's 8 out of 10 now, and I say, okay, well, let's look into it. But that's how we evaluate pain per se. But we have a test called myovision, and the myovision measures both the muscle activity in your spine and also the motion of your spine. So, for example, I might tell you to bend over, try to touch your toes with certain sensors attached to your body. And I will see very quickly whether your muscle reactions and the way you're moving is consistent with a significant pain generator that I can identify, or whether there's something else going on that I'm not seeing with that test. But it's part of a complete diagnostic workup, and it takes about an hour to test both the cervical, the neck, and the low back regions, and it costs $75. And the insights that the patients get, they're very impressed with what they've learned about their own bodies. And as a doctor, myself or Dr. Gear tells us a lot about the patient as well. And X-rays are great. If you go to the emergency room, for example, and they take X-rays, they generally just take a picture of you lying flat or standing up straight, and they don't look to see how your spine bends. And a lot of the pain generators occur when you bend this way or that way, and if we don't actually see X-ray images of how the spine is moving, it interferes with the ability to get a good diagnosis. And as I've said before, a good treatment depends on a correct diagnosis. There are ways to evaluate just by touching the patient and so forth, but the visual of seeing how the bones are moving is invaluable.
I can imagine. I've seen that myself. I went through the X-rays, and gosh, I don't remember how many. Over 100, I think, in all different positions.
No, we didn't do that many. I think it's okay. 23 different views.
Really? I thought it seemed like
No.
There were more.
No. Actually, if you go to get what's called a CAT scan, that is many X-rays that are being taken in rapid succession, and so there's probably more radiation in one CAT scan than the full Dr. Gear protocol for the X-rays in various positions. So with the modern equipment that's very sensitive, it's not that much radiation exposure.
Right. It's not quite the way it used to be when it first came out, that's for sure. Are you still doing the evaluations?
Yes.
Free evaluations?
Yes, we have free 15-minute consults for either musculoskeletal pain or internal medicine issues. I am trying to fill Dr. Gear's very large shoes and am having success in making patients happy with spinal manipulation treatments that I'm doing. And we just had a new patient come in today, talk to me. I gave him a trial treatment or demonstration treatment, and he's going to get his X-rays, and he's excited about being a patient.
Good.
So I can't do everything Dr. Gear can do, but I can do a lot, and I'll be quite honest with you about what my limitations are. But a lot of patients are getting great benefits.
All right, and that to make that appointment, the number to call is 928-474-7409. Correct?
Yes, and if we don't answer, leave a message. We're only staffing the office limited hours right now, according to patient demand. Mm-hmm. So Tuesdays and Thursdays, you'll get a live person, most likely. Any other time, we'll call you back.
Okay. Once again, that's 928-474-7409 or 09.
Yes, and again, that's a free consult. If you have X-ray discs, bring them in, and I'll go over them with you. If you have lab tests, bring those in, and I'll go over those with you and tell you how I think I can help you. Or if I don't think I can help you, I'll be honest with you about that as well.
Well, one other thing, we're just about out of time. Before we go, I would like, if you would, tell people your website, how to reach it.
Okay, my website is just drweyrich.com. That's all you need. You can put a www in front of it if you want.
And spell Weyrich for everybody.
drweyrich. And the home page has up at the top, click here for the menu. And it'll drop-down menu, and you can look for frequently asked questions. You can look for disorders treated, where I talk about all kinds of different things, and I have web pages for what I've talked about tonight under urology and under cancer. So look at those two areas, and you'll find the topics that are relevant to tonight's discussion. And I'm trying to get the past KMOG Doctor's House Call shows up on my website. I've been distracted with other things about the office that have to come first, but I'm going to be putting up the additional podcasts of the show. There are some available already if you go to the Multimedia Archive tab on the drop-down menu.
Okay. Well, we're out of time. Thank you for joining us on Doctor's House Call. We look forward to you coming by next Tuesday. Any idea on your topic yet for next Tuesday?
No, we haven't chosen a topic yet, but perhaps we'll get Dr. Gear on again.
That'd be great. As a matter of fact, we could set it up so Dr. Gear could talk to people and answer their questions when they call in also. So.
Okay, we'll have to work that out with Dr. Gear.
Okay. Certainly hope he feels better. Every time I talk to him, he sounds a little bit better. So
yes.
He's rehabilitating. That's, I guess, what it's all about.
And he's a fighter.
You betcha. All right.
You've been listening to Doctor's House Call, aired every Tuesday afternoon from 5 till 6 p.m. To call Dr. Gear after the show during his business hours at Payson Health and Wellness Center, 801 East Highway 260, call 474-7409 or go to his website, drbobgear.com. That number again, 474-7409.